Hello all, greetings to you. I am Dr. Neema Bhat. I am the lead hematologist, BMT physician and CAR T-cell therapy specialist. I am a senior consultant hematologist here at Apollo Hospitals, Bangalore, and I draw experience over a vast number of years from my training in the US as well as my practice in India. Today we are going to talk about the concept of CAR T-cell therapy, or what you might have heard as CART. So what exactly is this CAR T-cell therapy? It is chimeric antigen receptor T-cell therapy. To put it in simpler words, it is the process, the medical process, which goes above and beyond your usual chemotherapy, immunotherapy, bone marrow transplantation, and it is a step beyond in medical advances or medical science advances, where we have tuned or woken up the body's immune system to start attacking diseases like cancer, especially blood cancer. So what exactly happens in CAR T-cell therapy? We have different parts of our immune system which help us fight infections. An important part of this immune system is T cells, and these T cells over a period of time are taught to not attack our own body cells. However, when we have cancer cells which are not responding to chemotherapy or immunotherapy, or sometimes relapse post bone marrow transplantation, we can prime these T cells to recognize the cancer as a foreign or as a harmful thing that is existing in our body, and we can train the T cells to attack these cancer cells. In this way, what we are doing is we are constantly keeping a vigilance of the body's own immune system to attack the cancer cells. This therapy is recent, quite accomplished, as in it comes with very good data, especially for certain medical conditions or certain blood cancers. Namely, blood cancers like B-cell acute lymphoblastic leukemia or BALL. It is approved for patients who have failed at least 2 lines of therapy. So they should have failed at least chemotherapy and a second line of treatment, or chemotherapy and bone marrow transplantation. It's approved for patients above the age of 9 to 10 years, all the way until 60, 70 years of age. B-cell ALL patients can be quite challenging to treat with chemotherapy and stem cell transplant, especially if the disease is chemorefractory. So there are some ALL or leukemia patients who do not respond to chemotherapy, and CAR T-cell therapy plays a huge role in trying to bring this disease under control so that they can get a longer remission. The next indication is lymphoma. So there are different types of lymphoma, specifically B-cell lymphomas. And in that, aggressive types of B-cell lymphomas are a large target for using CAR T-cell therapies. These aggressive lymphomas can again be very chemorefractory and can come back very quickly after chemotherapy, and also autologous transplantation in some patients. When we have no more chemotherapy or immunotherapy to offer, or we feel that the patient will respond better if their own immune system is primed to attack the cancer, that is when we start using CAR T-cell therapy. Another new and upcoming disease against which we are using CAR T-cell therapy, which is multiple myeloma. So again, multiple myeloma is a chronic blood cancer which can be refractory and can come back repeatedly after chemotherapy, and sometimes also after autologous bone marrow transplantation. And in these patients, CAR T-cell therapy can play a significant role in bringing them to remission and giving them longer disease-free periods. What exactly is the process? So it sounds like a very fancy treatment, but the concept is quite simple, and it's very similar to a bone marrow transplantation. What we do is we assess the patient, we make sure to evaluate them thoroughly to see if they're ready to undergo CAR T-cell therapy, mainly because this treatment doesn't come without side effects, but if managed the right way, evaluated the right way, then these symptoms can be easily managed. So the patient has to be evaluated for what is their disease burden. We have to see if their organs are healthy to be able to tolerate CAR T-cell therapy. And then we do the collection process where the patient is, they have a central catheter placed, and then just like a dialysis process, we collect these T cells. They are processed in a particular lab close to the hospital. They're expanded in numbers, and then after giving chemotherapy, the same activated T cells are given back to the patient so they can continue fighting the cancer. The stay for international patients specifically, it's important for you to plan the logistics. It's best if the patient has responded to some chemotherapy or if they have lowest disease burden possible before they are referred to us for CAR T-cell therapy. We would advise that the patients stay in India for at least approximately 6 to 8 weeks for the whole collection process, lymphodepletion, as well as the reinfusion of CAR T cells and monitoring of the symptoms or side effects of CAR T cell therapy, after which they should be safe to travel back to their country. The entire process takes about 6 to 8 weeks, but can be extended up to 12 weeks because it can come with some side effects, namely ICANS, which is a neurotoxicity that comes with CAR T cell infusion. It can come with CRS or cytokine release storm, where these cells can cause certain chemicals called cytokines to be released, which can give the patient fevers, rashes, sometimes changes in their blood pressure, heart rate, and saturation. So patients need to be monitored in the hospital for at least approximately 2 weeks before they are considered ready to be fit for discharge. These are the most salient points that I would like to highlight about CAR T-cell therapy. But the last point is, rather than depending on chemotherapy or immunotherapy, we are depending on our immune system to be primed and to be on the lookout for any cancer cell that pops up, so that we are able to give patients longer remission and disease-free intervals or periods. Thank you.